Hi, I'm Dr. Carlos Saldana, and today we will be discussing important resources related to HIV pre- and post-exposure prophylaxis. It is important to have these conversations because Gwinnett, Newton, and Rockdale counties are experiencing high HIV incidence rates. Gwinnett County is one of the 57 priority jurisdictions in the ending the HIV epidemic. These are locations identified throughout the nation that have some of the highest incidence of HIV. Since at least 2014, there's been an increase in diagnosis in HIV, particularly in Hispanic and Latino communities. This is also accompanied by new diagnosis in Black and African Americans. And it's one of the reasons it's because individuals are not accessing or are not aware of medications that can help prevent HIV. PrEP is a medication or an injection that, when taken as prescribed, can help reduce the risk of acquiring HIV by close to 100%. Its role in ending the HIV epidemic is that these are highly effective medications, these are safe medications, and individuals need to be aware of them so they can reduce their risk as much as possible. Compared to other tools to prevent HIV, PrEP as a pill or an injection is one of the most efficacious one in preventing HIV. We also have condoms and other tools that reduce the risk, but not as a high degree as PrEP. When talking to clients and they may not be upfront with their sexual health history or their practices, it is very important to normalize, again, to tell them that you talk about these topics with every single patient, and if they feel comfortable, answer a couple of questions. When people experience side effects, most of them report having nausea, abdominal pain. And this goes away as people continue taking the medications. There's been a concern about PrEP causing small changes in kidney function and bone health, but this is quite minimal and is not associated to worse clinical outcomes and is not associated with fractures in terms of bone health. So we consider this quite minimal side effects, but the benefit of being on PrEP and the benefit of preventing HIV, it's much larger than any of these minimal risks. PrEP is covered by most insurance, but for uninsured individuals, there are also patient assistance programs that are coming from pharmaceutical companies. They can access these medications for free or low cost. There are also federal programs that provide assistance for and cover medication costs to help access these medications. If for whatever reason, providers don't feel as comfortable for prescribing PrEP, there are a variety of resources online that can help providers identify who can prescribe PrEP in the community, making sure that convenient locations are given to patients so they can access them. You don't have to be an infectious disease or HIV specialist to prescribe PrEP. It is quite easy to prescribe it and monitor it, and we do it all the time. So I invite all the providers to familiarize themselves with resources available for PrEP. PEP is also referred as post-exposure prophylaxis. It is a set of medications that are commonly used to treat HIV. These are given when patients are exposed to HIV, either through sexual encounters or by sharing needles. It is important that patients take this in a timely manner to have the highest efficacy in preventing HIV. It is critical that people know that they should receive these medications within a 72-hour period to reduce the risk of acquiring HIV to the maximum possible. Baseline laboratories include tests for sexually transmitted infections, including HIV and hepatitis serologies. Patients will be taking these medications for up to 28 days when these tests should be repeated. Afterwards, it is important to have conversations on transitioning to pre-exposure prophylaxis for patients so they can reduce the risk of acquiring HIV later on. There is a variety of resources that we can make available for patients when accessing post-exposure prophylaxis medications. These include calls to the health department. There's emergency rooms throughout the city that are equipped to prescribe these medications, urgent care, but it's important to remind patients that timing is crucial in these circumstances. Any person that has an exposure that could increase the risk of acquiring HIV should be aware of these resources and contact the health department as soon as possible.